All nurse practitioners pretty much in our office, we see patients just like any of the physicians do. We have our own patient panels, but like in our office specifically, well, and pretty much everywhere now, we see everybody's patients. Acute visit, if you're sick, your long-term, your preventative visits, your follow-up visits, all of that stuff. We can do just about everything that the physicians can do in the office. So, I mean, we manage everything.
So the APPs in our office play a role very similar to any other provider. So we utilize the APPs in our office to see patients and handle any of the clinical problems that may come. We really have taken an approach in this office to treat them as much like any other provider, which has been a little bit different than some other offices. They do carry their own panels, they see overflow, they do everything that anybody else would do, and everything that I do day to day. There's the credentials and the letters are a little different. There's some minimal stuff that changes. There's some orders that I have to sign because I'm the physician in the office, but overall they do essentially 95% of the same work that I do every day.
That's the great thing about family practice, is that you get to see people sometimes even before they have a problem, and you get to, maybe help them prevent that problem. And so that was a big reason for me in choosing to pursue a further degree. APRNs at this point in Ohio do have to have a collaborating agreement with the physician, so we definitely have kept by that law and have a standard collaboration that we have signed in. Basically that just recognizes one physician as our doctor that backs us up, basically, and Dr. Allen's that for both Sarah and myself, and in this setting it has been a huge asset to have that, because there are things that we may not have seen yet or come across, and he is always there to help us in those situations. And then it also allows us to work together as a team.
The advantage for the patient in this relationship is really that it allows the patient access to healthcare that they may not have been able to get. I'm one person. I have a limit of how much I can do and see every day. If we find good people around us that can help and, for lack of a better term, extend that ability to take care of the patient, that's their advantage, is that they have that extension. So if you think about these folks here, very similar personalities to mine, very similar way that they take care of patients, that allows us now, between the three of us, to see maybe 75 patients a day as opposed to 25 for just me, which I think is very important for the patients. It's access to care.
By allowing APPs to kind of help bridge that gap a little bit, because there aren't enough family physicians to cover the needs, we kind of can help, we fill that gap, and we can help with a lot of those care needs and things like that hopefully are going to keep them from getting to the point where they need to be hospitalized.